Welcome to Module 4 of Health and Safety for Center-Based Educators. This module is the fourth in a four-part online series and focuses on emergency preparedness in the child care center. All child care programs and centers in Rhode Island must be prepared for emergencies such as a natural disaster, fire, or other man-caused events. The Department of Children, Youth, and Families, or DCYF, requires all programs to have a protocol in place for emergency preparedness and response planning. You should have an emergency plan for evacuating children, and this plan must be posted in all classrooms. All staff members and families must be familiar with the evacuation plan and know the location of the outside meeting space. The plan should include 2 ways to exit each classroom and should also include contact information for children's parents, family members, and emergency contacts. You must have an additional emergency plan in place for any children or staff with special needs. You must work with these children's families and direct care providers to develop a plan that is appropriate for that child or staff member. Child care programs also are required to hold 15 fire drills every year. These drills should be conducted in various weather conditions at different times of the day and with obstructed and unobstructed conditions. All center staff must be familiar with the location of all fire extinguishers as well as all exterior exits. Additionally, programs must have provisions to evacuate infants, toddlers, and children and staff with special needs. If your program cares for infants, you must have an evacuation crib for every 5 children under 2 years of age. This crib should be on wheels and meet evacuation standards. Another important piece of preparing for an emergency is having well-organized emergency contact information. Phone numbers for local hospitals, fire stations, police departments, and poison control shall be posted near a classroom phone. DCYF also requires that you have emergency contact information for every child in your classroom. The names, phone numbers, and addresses of parents or guardians and 2 additional emergency contacts should be readable. Every 3 months, ask families to review and update this information. Programs also must have an emergency medical treatment form for every child, signed by the parent or guardian. These treatment forms are kept on file and taken on field trips in case an emergency arises. You and staff need to be comfortable caring for a child who is injured. Since you provide care to children, you should be trained in first aid and CPR, which is short for cardiopulmonary resuscitation. DCYF requires that 50% of all staff within a child care center at any given time be certified in infant and child CPR and first aid. Contact your local American Red Cross office or ask your program director for information about trainings in your area. Every classroom must have a fully stocked first aid kit. This kit must be located out of the reach of children but readily accessible in the event of an emergency. Your program also should have a written plan for handling medical emergencies, and you should share this plan with all staff within your room and with the families of the children in your care. Be sure to restock the first aid kit with sufficient supplies after every use. The first aid kit should include the following items: adhesive bandages, disposable non-latex gloves, alcohol wipes, scissors, tweezers, thermometer, bandage tape, and safety pins, sterile gauze pads, flexible roller gauze, triangular bandages, eye dressings, and a cold pack. Syrup of Ipecac should not be included in the first aid kit or used to induce vomiting. Every classroom also should have an emergency bag or backpack that you can easily grab and that contains all the items you need for an emergency. These items include the comprehensive first aid kit we just discussed, as well as emergency information for each child, such as phone numbers for family members or neighbors and any specific emergency instructions for children with special needs, allergies, or medical conditions. A binder works well to organize this information. The last item you should have in your emergency bag are materials for children to use once evacuated from the center. If you are outside of the classroom extended amounts of time, you need to have activities to keep the children busy and engaged. Examples of such materials include paper, crayons, Play-Doh, and manipulatives that children can play with. This concludes Module 4, which focused on emergency preparedness in child care centers. Congratulations on completing the series, Health and Safety for Center-Based Educators. To receive your certificate of completion, you will need to complete the survey. A link to the survey can be found on the Module 4 webpage. For more information about the topics covered in this module, please contact the Center for Early Learning Professionals info line.